Hello, I'm Dr. Ronen Bordovsky. Today I'm going to speak with you about aesthetic dentistry. And what's aesthetic dentistry? It's all the part in dentistry that deals with aesthetic and building aesthetic smiles. Patients with yellow teeth, patients with rotated teeth, patients with broken teeth are coming to the clinic and we are fixing their teeth so the teeth will be white, straight and beautiful. In this section, I'm going to talk about two subjects. One is laminates, porcelain laminates veneers, and the second thing is zirconium crowns. And what's that? Laminates is a special technique invented many years ago, something about in the 50s, in the 60s, by an American dentist that tried to get for Hollywood actors a beautiful smile, what's called Hollywood smile. And his technique was based about a thin layer of porcelain that is glued in the frontal area and then giving the patient this beautiful smile, white and beautiful smile. Today, in the modern dentistry, the techniques were very refined and very sophisticated, and today we can do a very special laminate in the size of 0.5 millimeter without even touching the normal teeth and glue it in a special technique that combines the laminate to the teeth material and make them the same material, which means it's very strong, it's very beautiful, and the patient is not needed to do a root canal in the treatment or to grind a lot of his normal teeth. Another subject is the zirconium crown. And what's a zirconium crown? Crown is like a capping that is going above a teeth that went under root canal treatment or a very big areas of caries or a broken tooth that we need to complete. And in these cases, we are capping the tooth with a porcelain crown. In the old crowns, the core of the crown is usually made out of metal. Good metal, which means a metal that is combined with noble metals like gold, like titanium, or less expensive metals that are made of chrome and cobalt, which is not so healthy. Today, with the help of the technology, we can produce a crown from the computer and from a milling machine, a crown that is fully made of porcelain without any kind of metal. The material that is using this technique is zirconium. We are building a core of the crown from a material that is called zirconium oxide. It's a white material, very strong, stronger even than metal. But the highlight is getting a crown with no metal, even from the inside. It's more aesthetic. It's more healthy to the gums because usually with metals we have, during the years, we have something called corrosion. It's like the metal is oxidizing with the air from the outside and the moist of the mouth. And then usually we can see patients with crowns and a gray area in the gums. This grayish color is from this metal of the crown that is getting oxidized. In the zirconium crown, there isn't this situation because it's made of zirconium, and zirconium is not a metal, so it doesn't oxidize. Now, aesthetic. Even the most noble metal cannot be in the color of a tooth because a tooth is in a white or yellowish color and the metal is silver or black or a bit brownish. So we can achieve the aesthetics as we get it with zirconium crown. And another reason for doing zirconium crowns is the accuracy. The normal crowns are building by the hands of the technician, which is very good, but it cannot be as accurate as a milling machine, a computerized milling machine. The accuracy of a zirconium crown goes to 5 microns. And for the compression, the most accurate handmade crown is something about 25 microns. It's 5 times more accurate, and that's the reason that those crowns will last more years. So If I will have to sum everything up, then I would recommend every patient to do a zirconium crown, even in the back teeth, not only in the front, only in the aesthetic part, because this crown is more aesthetic, more accurate, and more friendly to the gums. Thank you.